So today in lab, we're going to be talking about patient-centered interviewing. We're going to review the 5 steps. You actually should have brought your PCIQ card with you. That's going to help. Then we'll review after you do your patient-centered interview. This will be a role play exercise. You'll have fellow students portraying patients, and then you'll switch. There'll be faculty observing, and then at the end we're going to have a debrief. So we can discuss what went right, what maybe could go better, and you will have plenty of time for questions. So let's get started.
Come in.
Hello, Mr. Scott?
Yes.
Hi, I'm Dr. Manis. It's nice to meet you.
It's nice to meet you as well.
Give me a second, I'll wash my hands and then we'll get started.
Okay, perfect.
Okay. Well, as I said, I'm Dr. Manis. I'm one of the family physicians here at the clinic, and they've set us a 15-minute appointment today. I see that you're a new patient. What would you like us to cover today?
Well, I'm having knee pain, and I'm really worried about my family history with high blood pressure.
Okay, all right. What else?
Well, I'm having issues with hemorrhoids, and I work out a lot, so it's becoming an issue.
Okay, all right. Anything else?
Not that I can think of. That should be it.
Okay, all right, thank you. Let's see, 3 things. Tell me which of those 3 things is the most important to you to get done today.
Definitely my knee pain.
Okay, all right. Let's start with that, and we'll see how far we get. I want to make sure and cover all your concerns. If we're not able to do it today, we may need to set another appointment, but we'll do our best, okay?
Okay, perfect. Thank you.
Well, tell me about this knee pain.
Well, it's my right knee, and I'm having problems when I'm running. It's also bad when I'm working out. I go to the gym a lot, and it's especially bad when I'm doing leg extensions at the gym.
So, worse pain with running?
Yes, when I'm running, I'm noticing that it's worse, but it's really bad if I haven't run for a couple of days. So I'm pretty active. I try and run or work out every other day, but when I take a few days off, that next time I work out or run, I have really severe pain.
That sounds like that may be important. Tell me a little bit more about that.
So I actually had a similar pain in that knee in high school when I used to run track, and I'm kind of worried because it's a big part of my life, and I don't know what's causing that pain.
Okay, so I'm hearing you're having some right knee pain?
Yes.
Okay. Occurs with running.
Yes.
You first noticed it when you were doing leg extensions at the gym,
Yes.
where you spend a lot of time.
Mm-hmm.
You like to work out. It's concerning to you, this knee pain, because you've had to curtail your activities in the gym.
Exactly.
Okay, all right, good. Give me a sec. Well, how are you handling this pain?
I'm trying to do okay with it, but a big issue is that running and exercising really helps me with my mood. So when I'm not able to run or exercise, I notice I'm in a bad mood by the end of the day, and I just don't feel like myself.
I can see where that would happen. Have you noticed that other than not spending as much time in the gym, that it's changed any of your daily routine?
Yes, when I'm at work, I'm noticing that I have problems. And it's harder for me to get around, which can not only be frustrating, but it lowers my productivity at work. And I just see that I think I get angrier often, or I get angrier more often, because it's a constant thing that I'm thinking about. Even if it's not hurting, I'm worried that it might start hurting.
Okay, I can see that. Well, I can see where that would concern you. What made the decision for you to come in today?
I'm really just worried that something is either torn in my knee, or that it's on the verge of tearing, or that it's going to be something that happens if I don't stop what I'm doing, or if I don't get it checked.
Okay, so I'm hearing that you're having this pain. It's concerning to you. You're not sure what it is, and that I know that can be worrisome and even anxiety producing or frightening.
Exactly.
Okay, I think you've done really well to not let it get any further, to go ahead and get it seen now before anything worse happens. And we can work together. I think we can get to the bottom of it, hopefully help you feel better and get back in the gym like you want to be.
Perfect. Thank you, Dr. Manis.
Absolutely. Give me a sec. Okay, so right knee pain, running, leg extension, limiting your time in the gym, even limiting some of your activities outside the gym, and concern that it might be something like a tear. Okay, all right. I'm glad I got that right. Let's see. Our next step, I think, is if you'll let me ask some maybe more specific questions.
Okay.
We can get some more specific details and see where to go next. Okay.
Sounds good.
All right.